BJC Accountable Care Organization, we call it the ACO, is an organization that's been designed to really enhance the quality and the efficiency of the care that we deliver to the patients that we serve at BJC. And we do that through focusing on the entire care continuum that a patient might experience, whether that patient is in our ambulatory setting, say in a physician's office, in the emergency room, perhaps going into an inpatient hospital stay, or even post-acute in rehab or therapy, maybe in a skilled nursing facility, or even back at home. So the focus is the enhanced design of care coordination across any of those healthcare settings that a patient might experience. The benefit to a patient from this expanded focus on care coordination, I think, really comes from the ability of the patient and their physician to share data, to sit down and have a very robust conversation about the care needs of that patient, regardless of what those might be. So specifically focus on something that's called an individualized care plan. This is a care plan that the patient and the physician will develop together that talks to whatever the issues might be that patient might be facing from a health status perspective. It'll be very individualized. It'll document what the situations are. What's the follow-up plan? What is the care treatment plan? And then the physician or the physician's assistant or care manager can work dynamically with the patient to make sure nothing gets missed and that everything is understood across that care plan. There's a big difference between an accountable care organization and an HMO. The Accountable Care Organization is an organization to which the physicians belong. And that's very distinctive from an HMO. That's when the patient belonged to an HMO. So in this care design plan, the patient doesn't elect or not elect to be part of that accountable care organization. Their physician does. And by doing that, the physician really is the one who is managing the overall plan, the care, and the patient, in this case, because we're focusing initially on the Medicare traditional beneficiary, they, in essence, just enjoy the benefits of the redesigned care plan. The other key point is that in an HMO, the patient was restricted as to where they could access their care. And in the Accountable Care Organization, through the Medicare program, patients remain able to choose whatever care provider they so desire. One of the things that the Accountable Care Organization is going to focus on is maintenance of healthy lifestyles, maintenance of a health status once the patient and the physician has stabilized whatever the chronic condition might be. And so the program is designed because we will be looking at the data associated with that particular chronic condition if a patient has one. We'll be gathering the information, we'll monitor it, and we'll ultimately improve it by virtue of this focus across the care platform. So a patient who has a chronic condition is going to have a very dedicated focus around that particular condition.